everybody, and thank you again for visiting the Connexus Healthcare channel. My name is Dr. Dave Adamson. We're taking time to provide education to our patients on healthcare topics that mean the most to you. And we're located in this beautiful Southwest Florida city of Estero, and it's absolutely gorgeous today. A little cold, but it's absolutely amazing. I wanted to take a moment and talk about stem cell therapy today because there's a lot of misinformation, a lot of confusion out there, and I want to start with the basics. So I wanted to let you know there's actually 3 types of stem cell therapies that occur today. All of them are what we call hemopoietic, or they're blood-based stem cells, so they're very safe and very effective in treatments. The 2 most popular stem cell therapies that occur today, number 1 is bone marrow. Bone marrow has a tremendous amount of blood cells as well as a lot of stem cells located within the marrow itself. The great thing about that is you can get it from yourself. All of us have it. It's part of the healing process. The other area that we can get it from you is your fat cells, or what we call the lipid cells within your body. A little bit of liposuction will pull out some of that blood as well as some of the fat. We can spin that down and actually obtain those stem cells as well. What I have found in my research on those 2 types of techniques is those cells are usually a little older. There's also not as many of them, and because there isn't as many, we don't get as much therapy or stem cells included in the therapy. So we do other things like PRP or prolotherapy, which we'll talk about later, in conjunction with that stem cell therapy to try to help that therapy work even better. The 3rd type of therapy that's out there, stem cell therapy cells that you can get, is from the umbilical cord blood of newborn babies. So during healthy deliveries, healthy moms, healthy babies, they actually harvest that information, that tissue and that blood, and so in today's world you can actually ask for your cord to be stored so you can access some of that great stem cell that's available. The great thing about umbilical cord blood cells that we use is they're more viable. There's a lot more of them and they're a lot younger cells. So just think of it, it's brand new cells coming from incredibly healthy tissue that's going to be used. The other great thing about it is extremely safe. The FDA said if we use the blood from cord blood, we know that they're very safe. It's very effective. Also realize the FDA requires us to test them for bloodborne pathogens as well as genetic mutation. If any of that happens, the whole cord and all the blood is actually rejected from use. So we know they go through a very stringent process to be used as a tissue donation. And the other quick thing I want to talk about is after you've chosen the direction you wanted to go, is how is the treatment going to be done? Are we going to do it injection and then you go back and visit the practitioner? Or are you going to actually be injected and then go through a therapy process? And we do a therapy process here in our office at Connexus because it's important to make sure that we develop a bed of cells that grow, and you have this viable tissue that's going to grow. It's like planting a seed. When we plant that seed in the dirt first, that needs a lot of nurturing. We need to water it, we need to care for it until it develops this incredible root system and the stalk above the ground starts to grow. If we do that with this tissue that we inject into our patients, we'll get a better result. So things like physical therapy, nutritional therapy, we use laser light therapy, we use chiropractic care, and a variety of other therapies to optimize the growth of the tissue so the patient outcomes are even better. If this is something that is interesting to you, I would love to actually meet with you and consult with you and find out if stem cell therapy is actually right for you. I got tired of being sick and tired, so I really wanted to start developing systems within our office that help you. So if you're tired of being sick and tired, give me a call for a consultation today.